Slowly preparing. Oh, there you go. Hi, everyone. Welcome back. Today, we're joined by Tony Wallin, our urgent care medical director here at Intermountain Healthcare, to talk about our testing process. Last week, Intermountain Healthcare updated their COVID-19 testing, and patients are now required to reserve an appointment arrival time, in most cases, to receive their COVID-19 test. Tony, it's nice to see you again. Thanks for joining us.
Thanks, Amanda. Nice to see you.
I want to talk about the why of this first. Why was this change made, and why was this change made? What did this decision just come from, and why is it so important that we made this decision?
Yeah, I think the obvious first answer is we're in a surge. And so the volumes at our curbside and our COVID hotline became so large that it's been hard to manage those volumes with the resources that we have. And because of that, our patient experience isn't what we want it to be. The other reason for it is it allows us to align with our other testing partners in the state who have already made these changes prior to us doing this. And it really helps us spread out the testing in a better way when we're all overburdened by a surge like this.
You mentioned aligning with other community members. The University of Utah has had scheduled testing for quite some time. So it's not like we just randomly decided to do this. It was an alignment. And you mentioned staffing. I think that's something really important for the community to understand and see, that we don't have an endless supply of staff to keep coming in to give the tests. So cutting back testing was very important. And it's not that we're cutting back testing for everyone. I want to talk a little bit about who qualifies for the test. And once you qualify or find out you qualify, how do you go through that process?
Yeah, well, we would have you call the COVID hotline and walk through the process with a person on the other end of the line. You can imagine that you only have so many people that can answer those phone calls. We hit a point of answering 7,000 to 9,000 of those calls, or trying to answer those calls. You can't do it. You can't answer that many. So we ended up capitating by not answering, which is not fun for patients. So rather than going through the COVID hotline, what we're having patients do now is go to our website and go to what's called our symptom checker. The symptom checker then will ask the questions about COVID symptoms, close contact, travel, those kinds of things. And then if you qualify for a test, it will then provide you with arrival window times, days and times to come in, so that you can plan ahead of when you come in. We require that you have nothing per mouth, nothing that you've had gum, food, pop, anything in the mouth for 30 minutes. So the arrival window allows you to prepare for that. And when you come into the curbside, the beauty of it is that there shouldn't be as long of a wait. You do have to answer the questions on a quick survey on the phone so we can get the orders in correctly, because the symptom checker can't order the test at this point. We're working on that, but it takes time for us to build that into our system. So for now, you will have to make a phone call once you get to the curbside, but hopefully much more streamlined as we get better at this. So there's less wait during, you don't have to wait on a phone call to the COVID hotline. You don't have to wait at the curbside very long. The other piece to this, to remind everyone, is the majority of our test collection is saliva rather than the nasopharyngeal swab, which is no fun because it goes down to the back of your throat. So the saliva, it does take a little bit more time, and you can't have anything oral, like I said, by mouth. So we try to plan that into the visit so that when you get there, you're ready to go and give us the collection.
And you mentioned not having to call the hotline anymore. I think that's very important. We heard the community say, I'm on hold for a long time. It's taking up a lot of my day to try to sit on the phone. So now it's a simple process of just answering some really easy questions related to symptoms. It walks you through some of the CDC data that's out there right now, asks you about exposure, like you mentioned, and filling out the survey to figure out an appointment slot time is really nice. But what happens if I can't find an arrival time that is convenient for me?
Yeah, if that will happen as we get larger into this surge, the more volume we have, the more chance of that happening. We are working on mechanisms to allow for increased arrival windows, such as preoperative testing that we're offloading to our labs from the curbside. So the curbside has more capacity to increase our volumes for this. But if you hit capacity and you do run out of arrival windows that make sense for you, you go to the Utah Health Department website and they will present to you at that website other options, other testing partner sites that have drive-through curbside testing choices.
And a couple of those websites for people, just so they know, our symptom checker can be accessed at intermountain.com/COVID testing. And the state's resources is coronavirus.utah.gov. It's very easy to find. You put in your address or your zip code, and it'll kind of give you the testing sites that are closest to you. So, say that you have a surgery coming up with Intermountain or some sort of procedure coming up. How does testing work for that?
Yeah, so the nurse for that surgeon will uh, uh, provide an order into our system for that test to be done, and then give directions to the patient on where to go and at what timing to go. Because with preoperative testing, it's all about timing. You got to have that test not too early in the game and not too late, so you can get the result back in time for your surgery. Right now, what they're having patients do is send them to the lab, where the lab will collect the saliva sample or a swab of some sort. It may not be a nasopharyngeal swab, it may be a different kind of swab. That's on the weekdays. The weekends, we still will see those patients if the timing is such that they need a test on a Saturday or Sunday. We will do those at the curbside and they'll be directed to do that. But during the weekdays, the difference now is rather than going to curbside, they'll go to our lab sites for that collection.
So I have a procedure coming up. Do I need to contact my doctor? Will they contact me? If I haven't heard from them, should I just go ahead and call them? I want to make sure that I am getting my tests before I go to the hospital. What's best practices on that?
Usually they will call you, but I'd recommend you also call them and get instructions. I would not show up to the curbside because you won't have an order in. If you don't have an order in, likely the curbside will say, go get an order first before you come to curbside. It's very difficult when you're managing these large volumes to try to manage people that don't have orders in place. So call your surgeon's nurse, clinic manager, that sort of thing, and get instructions from them.
I want to go over symptoms again really quickly. Can you just reiterate what we're seeing as far as symptoms go for COVID-19? And have they expanded at all since we started this in March? But what are those symptoms that people can start looking out for if they're feeling sick?
Yeah, the most common, right, most obvious would be cough, fever, body aches. Sore throat is included, nasal congestion / runny nose. One of the big hallmarks, if somebody has loss of taste or smell, that'd be a very good indicator that you'd want to get tested. And then, of course, beyond symptoms, there's also diarrhea, by the way, but beyond symptoms is contact tracing. Very important that people that have been exposed to somebody with a positive test, that they isolate themselves, right, for a period of up to 14 days. And the reason for that is that's how we stop transmission. So the reason why we want people to get tested, particularly people with symptoms need to get tested so that we know if they're positive, and they know they're positive. If they know they're positive, they can then contact trace themselves, plus the Utah Department of Health will also call them and contact trace. And what is contact tracing? You go find everybody who's come in contact with you and you let them know, if you're positive, that you are positive. That way they then self-isolate. That's how we're going to stop transmission.
My next question to you is going to be about why it's so important. What about those people who don't have symptoms, but they're the people get called for contact tracing? Why are they so important to get tested as well?
Um, Most important for somebody that's come in close contact is actually isolation, because what's recommended by the CDC is that they do not test until it's been 7 to 14 days after coming in close contact with someone. So the very first thing is to self-isolate. Then at 7 to 14 days, right, is a good time for them to know if they are positive, so that if they are, they can then contact trace with anybody that's come in contact with them. If they get symptoms within that period of 7 to 14 days, it's obvious. If you have symptoms, you need a test.
And is it fair for people to assume that they're positive and not get tested if they came in contact, or should they go get tested once they develop those symptoms?
I tell you, that's a tough one, right? I mean, they could do that, but they got to be really diligent about contacting people that have come in close contact with them and say, I could very well be positive. You ought to isolate. Now, how likely are your close contacts to isolate when you haven't been tested? It's much different if you call a friend and say, hey, I'm positive, right? I got a test and I'm positive. That's a much bigger deal to a close contact than if you say, I have symptoms, but I didn't get tested. I'm just going to isolate. Will they self-isolate? I don't know.
And with the holidays coming up, I think it reiterates how important it is, especially right now, to figure out if you are positive. It gives you that chance to go get tested. You have your 14 days, if your symptoms are completely gone by then, to then hopefully enjoy the holidays with your family. But if you don't get tested or you're kind of avoiding it, it doesn't really help you for the holidays. So now is the to get tested, definitely, if you have been exposed or you have those symptoms.
Yeah.
Tony, is there anything else that you wanted to mention to us about this new process at all, or anything you'd like to mention today?
Yeah, I would. That is, uh, think of a workflow or a scenario where somebody at home or at work gets tested positive, and they let everybody know that they've come in close contact, that they're positive. If all of those people come into or go to the bot, to the symptom checker, and get a test, right? They're taking up an arrival window from somebody that might have symptoms. And what we're seeing a lot of is people getting tests at the wrong time, especially when they're not symptomatic. It's much better that you do it at the right timing. The chance of a false negative, meaning you got tested and it was negative when you really still have the virus, is much higher if you get tested at the wrong time, too early, when you've come in close contact with someone, say 2 days into it. We have a lot of people bring the whole family in to get tested for somebody's that was positive from a cousin, and they take up all of the arrival windows from the patients that might need it today. So important to understand the timing of those tests.
Yeah, that's really good information, and hopefully people take that to heart and wear a mask. Make sure you wash your hands and keep social distancing. Tony, thank you so much for joining us. We really appreciate it. And if you guys have any questions, like Tony said, about symptoms or getting a test, again, that website is intermountain.com/COVID testing. Also, the state resource website is coronavirus.utah.gov. There's a link that says, where can I get tested? We also still have our emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. It is a free hotline you can use. The phone number is 833-442-2211. Again, Tony, thank you for joining us, and we'll talk to you soon.
Thanks, Amanda.
Bye.